This is Dr. Todd, your chiropractor in Maryland, with another fun grouping of exercises. This I highly recommend for a lot of my patients here in Columbia and Annapolis, and then you can check with your provider to see if it works well for you. This range of hip exercise ranges from some beginner moves to intermediate to advanced. 3 moves that cover a full spectrum of care. Let's get started about how to rehab your hips and a little bit of your low back and also your SI joint with these exercises. So we're going to lie on our side. Now when we lie on our side, yes, you can fill a pillow in here. You can put a pillow underneath your ankles. You can put a pillow in between the legs there to keep it neutral. But I also like, if you have enough strength, trying to push down with your bottom leg and push down with your arm, raising your whole body up if possible to neutral. So now I can kind of put my arm in here, and there's a little gap here, and I'm raising my head up as I draw my shoulders down. Just did a video on how to do these exercises for shoulders. Now we're applying these same constructs to the hip. So the first one simply is a clam exercise, keeping our feet together, making sure not to move our pelvis. We're going to open up our hip as far as we can and then close, repeating that about 10 times. Where we make mistakes is sometimes people will rotate as they open, or sometimes what they'll do is they will overarch the back. The person who is filming us right now makes that mistake sometimes. So anyways, we all learn from these things. Now my feet are against the wall. If I had a wall, this would be really good because I could put my back and my feet against the wall as I executed this, and that way if I started to rotate, I could feel that I was starting to rotate too much from the pelvis. The next action is adduction. I take my leg straight, and then what I'm going to do is move my hip back. Now the major mistake here is, this is a great one at first to do against the wall, because a lot of times when we lift, a lot of us will come up here, and that's not pure abduction, and I can feel these muscles more working in the front. I want to come right back here so that I feel my adductors. These muscles contract, and the muscles in the front, the hip flexors, remain fairly loose. At the same time, I'm keeping my back nice and tight. The 2 major mistakes happen. Yes, we roll like this, or again, we overarch our back. Again, about 10 reps of that. Hope you all are doing well with this. Our final action, one of my favorites, is I think it's very Pilates oriented, and that's a great grouping. If you want some more information on that, hey, check out some good Pilates videos out there. They're great. So anyways, we're still staying on our side. We're pushing our arms down, pushing our legs down. And finally what we're going to do is we're going to take our knee up to our chest, and then we're going to bring it up as far as we can. Then we're going to stretch out our leg as straight as we can. And then what I'm going to do, I'm keeping everything in a line. As I push through my leg, I'm again lining up my spine, keeping everything active, and then I'm keeping my hip, knee, ankle, and second toe on a line. I'm going to bring it back as far as I can, making sure not to arch my back. Then I'm going to come forward. I'm going to bend my knee when I get to the part I can't go anymore, and then I'm going to pull that back up, and I'm going to repeat that again another 5 or 10 times. Then I can go on to the other side and do that. So this is a simple series. And you can start with just clams, and then maybe work on to abduction, and finally sideline bicycles. I hope this really helps you out. Comment below if you want to see other content. Give us a thumbs up. Don't forget to subscribe. And again, if you're not a patient of mine, check with your health provider to see if these and other exercises would be good for you. Until next time, take care.